Hi, and welcome back to Epic's Kitchen Table Talks, a series of conversations regarding issues affecting you, the families that we serve. Our topic today in COVID Conversations is about social distancing and the precautions that we can take to keep our families safe. There's a lot of conflicting information out there, so we're here with Dr. Tony Vitrano from Century Airport Pediatrics, and he's going to break that down a little bit more for us. Dr. Vitrano, what are things that we can do to keep our families safe?
Well, we can stay 6 feet apart, which is what we're doing right now. In normal conversation, my speech will not get to you and your speech will not get to me other than the words. So it's important to keep that distance. There are many people reporting different degrees of separation, but 6 feet's a good average to go by. And when not possible, 3 feet is another thing that we should strive for. So more importantly, I think, than even the social distancing, and that is very important, but I don't think there's enough emphasis on how this virus might spread from person to person. This particular virus is most likely to spread by contact, by touching things. So all surfaces that we touch together, separately but together, faucets, refrigerator handles, cabinet drawers, doorknobs, door handles, utensils, those are the places that it'll spread. These viruses will live on hard surfaces for 30 minutes to 2 hours. There's a lot of reports that you can pick up the virus after 2 hours, but a lot of those viruses are dead. So it's hard to know after 2 hours, but still think of the number of surfaces we all touch within a 2-hour period. And in an office setting or in something other than a home setting or in a setting where there's a lot of children, you can imagine how quickly a virus could spread. So masks are the other big thing that people talk about. And that's a very confusing topic because, masks are good when worn correctly. The problem is when people touch the mask frequently, which most people do who haven't worn them for a lifetime, then you would have the risk of spreading it more because you're touching the mask and then touching something else and touching the mask and adjusting the mask. So we really need to be careful that if we're going to wear masks, the goal is to not be touching that mask frequently. When you're outside walking and there's not many people in close proximity, you don't need the mask. But when people are in close proximity, a playground or any event where you go to the store and you go in the store and now people are closer together, then the mask is a good thing. So we just have to be smart and common sense when it comes to masks. The distancing has been well documented, and again, I think we've taken it to a limit where it sometimes scares children and confuses them. So again, I would just tell them they're old enough. Most children, as we talked about in the previous segment, are old enough to understand that if we touch the same things, we could spread something. Any germ or dirt, they would see it as the same thing. And the closer we are together, the more we could spread something. But as a close family, you can stay together. So the idea of going where you don't know what's around you, that you have to be more careful. So social distancing does work, but we can take it to an extreme that scares children. So again, common sense would be appropriate. There are a lot of good medical things coming. So even by the time somebody looks at this might be totally changed about how we're going to evaluate who has the disease or who just has the virus without the disease and who can spread it and who can't. So I would ask that people keep their antenna up, try and get the right information. The CDC website, the Erie County Department of Health website are pretty good and updated frequently. So for any medical question, you would ask your doctor, but also go to those websites because they will provide updated, accurate information. And lastly, the newspapers and television stations, there are some that are reporting more than they really know about. There are others that are reporting negative all the time. So you really can't use that as your source of information. So again, CDC website, Erie County Department of Health website, New York State Department of Health website are fairly accurate when it comes to the medical questions. And that should give parents a basis to work with.
Great. Well, thank you so much, Dr. Vitrano. Thanks for joining us for this episode of COVID Conversations. For all of this and more, you can head to our website, epicforchildren.org, on our coronavirus resource page. Thanks so much.
Thank you, Liz.
Thanks.
Very good.